How and when you can get a COVID-19 vaccine will vary a lot. We're going to unpack the process and the variables. Some practical parts, like getting the shot itself, might go a lot like getting a flu shot in the doctor's office, hospital, or pharmacy. Though brace yourself for the possibility of 2 shots, not just 1.
Here's another difference. Expect to receive this paper record card when you get your vaccine. It's designed to keep track of your doses, but also to remind you when you need the second shot, if it's required. If you don't get a card, ask about it.
Overall, the CDC says the COVID vaccine rollout will be much larger in scope and complexity than seasonal influenza. One of the key challenges is who gets priority, especially if there's short supply early on.
The CDC committee that recommends vaccines said it should be offered to both healthcare personnel and residents of long-term care facilities first.
Who's next in line might hinge on where you live and who's in charge. A tiered system is possible, and states will have a big say.
Let's look at California. It'll get 327,000 doses for the first wave. The state set up 6 multi-county regions. Each gets a different number of doses. Long-term care residents and healthcare workers are first up, but health workers must follow a pecking order. The state's broken them into 3 tiers. First dibs, frontline workers like doctors, nurses, and paramedics. Next, in Tier 2, people like home health and public health workers can get their shots. Finally, in Tier 3, lab workers, dentists, and pharmacists are eligible for a vaccine. Who's next hasn't been announced.
That might fluctuate based on the case count at the time and whether the labs creating the vaccine are keeping up with demand. State and local health departments monitor all of that. So to figure out your place in line, follow them on social media for updates or sign up to see if they have email alerts or text alerts.
You can find more COVID-19 vaccine information at nbcbayarea.com/vaccine.